Everybody, high emotions, such as sadness, are a normal part of the human experience. However, when these feelings become overwhelming and persistent, they can develop into clinical depression and serious mental disorder. Understanding the differences between clinical depression and normal sadness is crucial to effective treatment and finding the right treatment. Sadness is a natural emotional response to certain situations such as disappointment, loss, or setbacks. It is usually temporary and goes away as you come to terms with the changes in your life. Normal sadness does not significantly impair your ability to function in daily life. Clinical depression or major depressive disorder involves intense feelings of sadness, emptiness, or hopelessness that are persistent and significantly impair a person's ability to function. It is a diagnosed mental health disorder that involves physical, emotional, and cognitive symptoms that last for at least 2 weeks or longer. Sadness is often short-lived and related to a specific situation. Depression is persistent, with symptoms lasting most of the day, nearly every day for at least 2 weeks. Sadness does not usually prevent a person from performing daily tasks. Depression significantly impairs daily functioning, affecting work, relationship, and routine activities. Sadness can sometimes include a temporary feeling of worthlessness. Depression includes numerous physical and emotional symptoms such as significant changes in sleep and appetite, loss of interest in most activities, feelings of worthlessness, recurrent thoughts of death, and physical pain without a clear physical cause. A common misconception is that people with clinical depression can simply cheer up by engaging in pleasurable activities such as watching a happy movie or listening to happy music. This misconception can lead others to view depressed people as weak or lazy, much like blaming a diabetic for not healing themselves with positive thoughts. The biochemical and physical abnormalities in the brain of those with clinical depression prevent them from lifting their spirit through activities that might help others with normal sadness. PET brain scans have shown that people with clinical depression have actual physical differences in brain activity that contribute to their symptoms. These scans provide concrete evidence that depression is not just a state of mind, but a physical condition that requires appropriate treatment. What to do in both cases? Managing normal sadness. Participating in enjoyable activities can really help lift the spirit of those experiencing normal sadness. Allow yourself to be sad and express your sadness. It's healthy to acknowledge and talk about your feelings. Coping with clinical depression. Seeking help from a mental health professional is crucial. They may recommend therapy, medication, or a combination of both. Recognize that clinical depression can prevent you from enjoying activities that you used to enjoy. Reach out to family and friends for support and explain what you are going through to avoid misconceptions. Understanding that it's okay to ask for help can go a long way in helping you cope with both normal sadness and clinical depression. Distinguishing between normal sadness and clinical depression is vital to taking appropriate mental health measures. By understanding these differences and knowing when to seek help, people can better manage their emotional health and get the right support and treatment when needed. Thanks for likes and sharing.